Hello, hello, hello. Happy Saturday afternoon. We're just coming live. We're going to sit for just about a minute or two and let this populate. But for those of you that are just joining us, welcome, welcome. Thank you for joining us this Saturday afternoon. Hey, Not Alone Notes, Morgan and Molly. And feel free to say hi. Let us know where you're from. We'll give you a shout out. Just take 1 minute or so just to get people the notification and come in and say hi. And then we'll get rolling and get started. We have a great town hall for you today with some excellent guests. So we'll be answering lots and lots of questions. So you're in New York. So it's Molly. Hi, Molly. Hi, Ginny. Athens. Oh, Athens is so close. Boston, Iowa. What's up, guys? Welcome, welcome, welcome. We had last week, did we have Singapore? We had some really interesting places. Australia, Massachusetts, Phil and Ashley in Boston, Monterey. Monterey is beautiful. I'm jealous. We're going to go hang out with Eric in Monterey, DC. Hi, Haley. Hey, wonderful humans. Hi, Katie. All right. So just in a few seconds, Austin, Texas. Like Texas, I was born in Houston. Awesome, awesome. So just in a few more seconds, we'll get started. We're just at about almost 2 minutes. Actually, we'll go ahead and get rolling. So first of all, thank you for joining us for the second official edition of Just Ethan, the COVID-19 OCD Town Hall. My name is Ethan. If you don't know, oh no, I'm doing the hand thing. If you don't, anyway, if you don't know me, I am the National Ambassador for the International OCD Foundation, which simply means that I have OCD and I like to talk about it a lot to a lot of people. So last week we had a really amazing turnout, a lot of great questions, and we covered a lot of ground. So I'm actually not going to speak as much as I did last week. I'm going to keep this introduction short. If you have questions, please go ahead and write them in and load them into the comment box. I will be going down the comment thread chronologically. We will try to get to as many questions as we possibly can. We will give resources at the end. So if for any reason your question was not answered, you can email us at a number of different places and we'll make sure you get the answer to your question. We have some amazing guests with us today that I'm super excited. So thank you for joining us. But above all, we're here to support you and also to support us. We're in this together. It's really remarkable times and very strange and different. So it's important we all come together as a community and really talk about what we're all experiencing and support one another. So thank you for taking your Saturday afternoon to join us. So let me get to the introduction. We have three amazing guests today. We have Dr. Reid Wilson and we have Dr. Aureen Wagner. You are a doctor, right? You're just
yes.
Okay, cool. I thought
psychologist.
So.
I'm a clinical psychologist. Yes.
Okay, perfect. So let me just read some brief introductions so you know a little bit about the people that we're talking to, and then we'll go from there. So we'll start with Shala. Shala Nicely, LPC, is the author of Is Fred in the Refrigerator? Taming OCD and Reclaiming My Life, and which is an awesome book. I highly recommend it. And co-author with John Hirschfeld of Everyday Mindfulness for OCD Tips, Tricks, and Skills for Living Joyfully. She's a counselor and cognitive behavioral therapist in Metro Atlanta, Georgia, specializing in the treatment of OCD and related disorders and anxiety disorders. Shala produces the Shoulders Back, which I like to read out because it gets me, let's all put our shoulders back, tips and resources for taming OCD newsletter, and blogs regularly for Psychology Today, offering an inside perspective on life with OCD. We'll give out Shala's information later in the town hall. Next up, we're very excited to have Dr. Reid Wilson. Reid is a licensed psychologist. He's author of Stopping the Noise in Your Head and the classic self-help book that we could all use right now, Don't Panic. So we'll have lots and lots of questions for Reid. He's co-author of Stop Obsessing, as well as Anxious Kids, Anxious Parents, and Playing with Anxiety. We have a lot of really impressive authors today, actually. So Dr. Aureen Wagner is adjunct associate professor of psychiatry at the University of Northern Carolina, Chapel Hill, director of the Anxiety Wellness Center in Cary, North Carolina, and member of the Scientific and Clinical Advisory Board of the IOCDF. Dr. Wagner specializes in CBT for childhood anxiety and OCD and is the author of Worried No More, Help and Hope for Anxious Children, Up and Down the Worry Hill, which I love. I love is not part of the title. That was my own opinion. Up and Down the Worry Hill, a children's book about obsessive compulsive disorder and its treatment. What to do when your child has obsessive compulsive disorder, strategies and solutions, and treatment of OCD in children and adolescents, a professional's kit. You have an amazing resource right here and some incredible, well-published, brilliant, caring, thoughtful, compassionate individuals. We're going to lead off with some brief introductions, and then we'll get right to your questions. So, Shala, why don't we start with you?
Sure. So, as a person who has had lifelong contamination OCD, I think I feel a little bit right now like I'm in a boxing ring with OCD, but my hands are tied behind my back. And so I'm bouncing around this ring, trying to get away from my OCD as I'm doing things that to my OCD look clearly like compulsions, and it's able to land, some pretty good punches. Earlier this week, I was cleaning my car, not because of coronavirus, just because my car was filthy. And I found on the floor some little pieces of candy that had fallen out when a bag of candy had fallen open in the car a couple weeks ago. Normally, I would have taken that opportunity right away to just eat all that candy right off the floor, because those are the kind of things that I am used to doing on a daily basis to keep my contamination OCD in check. But because of the current situation, I didn't really know if that was that good of an idea. And it was with a lot of sadness that I took the vacuum and vacuumed up the little pieces of candy. And as I did that, because I wasn't sure whether that was a good thing to do or not at this point, I felt this longing for the way I used to do contamination exposures. Because for anybody who's ever read any of the things that I write, I'm very aggressive with my OCD. And that's enabled me to have a really good recovery. But now I'm not able to be as aggressive as I would like. So what I decided I was going to do was I was going to write my OCD a letter, because it needed to understand what was what in this current situation. And so I wrote it a letter, and I stated that sometimes it's winning because I'm doing things that to it look like compulsions. But sometimes I'm winning when I'm following regulations and doing no more, or when my OCD is whining about, but that wasn't enough. And I'm like, we're not doing any more anyway. And I reminded it of one of my favorite stories from Is Fred in the Refrigerator, from, in fact, when I was a patient in Dr. Reid Wilson's group like a decade ago, when I did what I thought were such amazing contamination exposures that I made my OCD just pass out right onto the floor. And I reminded my OCD of that, and I said, if you thought that was bad, that is nothing in comparison to what I'm going to do to you when this pandemic is over. Because it's not just going to be that my hands are going to be unhandcuffed from behind my back. It's going to be like I've grown extra arms, and I'm going to be like an octopus with boxing gloves coming after my OCD. When I wrote this letter, I felt so empowered that I decided to put it on my website, both as a letter and as a recording. And I encourage you to do the same, to write a letter to your OCD, read it out loud in a forceful tone. Tell your OCD that although it may be winning sometimes right now, you're winning sometimes too. And in this war that it may feel like you're fighting with your OCD, you are going to come out being the ultimate winner. That it is not going to use this to take your life away from you. And we're going to post the links to my letter so you can have access to it after the town hall.
That's a great point, Shal. It's not about being perfect right now. It's about doing what we can to live each day as the best that we can. So before we get to Reid, just real quick, I saw some questions. Yes, if you have questions, go ahead and post them in the comment thread. We will go down chronologically and get to your question. So post your questions. Dr. Reid Wilson, what are you thinking?
Yeah, well, I'm going to take just 3 minutes, I think. You'll hear a little beep go off when my 3 minutes is over. I want to talk about perspective for those 3 minutes. What we don't think about much is that we've got unconscious processes going on here that are at play. And they are generating intrusive worries and obsessions all day long. Because we're facing this global crisis, we think that those worries are justified, and they are not. So there's three things I want to point out about that. First is the brain has a negative bias. And so it is going to look automatically for the bad stuff and the bad stuff first. That doesn't mean it's helpful at all. It's just going to be running in the background and popping those things up. We need to catch that and interrupt that. Second, worry thinks it's problem solving. Worry is not problem solving. Worry is problem generating. It's the step one of problem solving process, and we get stuck in step one, and we have to challenge that consciously. We have to challenge all three of these things consciously. The third thing I would speak to is if you are totally caught up, obsessively, anxiously worried about the broad nature of this crisis and how, as a species, are we going to get out of that? If that's disrupting you like that, you need to drop that topic. The way to think about that a little bit is we got this. Those of us who are not caught up in a painful set of obsessions around the future, we're going to figure this out and we will solve this problem. And you do not need to participate at that level. What you need to be doing is paying attention to yourself, your family, your loved ones, your friends, figuring out what problems you have to solve for yourselves, and make the big global issue none of your business. Because if you don't interrupt these three things and make them none of your business and recognize that they have no useful value, then you're going to suffer far more than you need to. And I'm sure some of the things we're talking about here we'll have a chance to expand on later on. So that's what I have to say right now, Ethan, to start with.
I have a million follow-up questions. That was so good. Okay, we'll definitely get to those in a minute. Dr. Wagner.
I've been working with children, families, and adults with OCD for over 25 years. So my comments are really also geared towards parents and families. But I would say this has been a mega exposure event in some ways for all of us, and it's pushed us way out of our comfort zones. And I think it taps into those 4 U's of anxiety and OCD. It's unfamiliar, it's unpredictable, it's uncontrollable, it's uncertain. The perfect recipe for anxiety and OCD. And it taps into OCD of almost any type. So if you have contamination OCD, it's like, oh, my worst fears of the pandemic are coming true. If you have intrusive thoughts, it's like, I can't turn off these scary images. What if I can't stop them? If you have scrupulosity, you might go, will I be the bad person because I passed it on to somebody and it'll be my fault? And if you have just right OCD and perfectionism, you might say, gosh, all my perfect routines are out the window now. Everything's topsy-turvy. So you see, it kind of really has shaken up, all of us in our daily lives quite a bit. But that being said, we can now use this time to worry about things we cannot do or to take charge of the things we can do. So that's what I would like to focus on, and that's what I've been doing in my work with my patients and families. What are the things we can do? So I came up with the 4 C's of what we can do: calm, consistency, containment, and caring. So first things first, it's really important for us to stay calm. And if you're a parent of a child with OCD or you're a parent with OCD yourself, ask yourself, what's my feeling temperature? So I use a 10-point scale that I call a feeling thermometer. And ask yourself, where am I on that? Because if you're a 7 to a 10, that's not the time to calm your kids down, obviously. Kids take cues from parents. They're looking to us as adults for reassurance and calm. So we have to watch what we are modeling for our kids. That's not to say you're not anxious or can't be anxious, but you have to contain that. The second one is consistency. So our routines are out the window. The kids are home from school. We're working from home. Some of us don't have jobs. We have to create a new structure and a new routine for yourself and for the family. Now, initially, A lot of kids are thrilled, yay, no school. But then the reality is going to set in, they're going to do some online work. But it's really important now to create expectations, rules, limits, and a balance between work and school. So yes, they've got to get their work done, but there can also be time for relaxing and, family time and fun, as long as it's separate from others. The third one is containment of the virus and of our worries. So we are being given a lot of instruction about containment of the virus from the health authorities, but let's focus on containing our worries. So I would say limit the news and limit discussion for yourselves as adults, but also for your children. Don't answer their questions anytime and on demand, because on demand reassurance feeds the cycle of anxiety and OCD. Instead, I recommend 1 or maybe 2 for your super anxious child, what I call check-in times or question times or worry times. Pick the name that makes sense for you. And that's limited to 10 or 15 minutes at a time. And that's a structured, prescribed time where that's the time you say, okay, now's the time, let's talk. What are your questions? Start with open-ended questions and start with the feeling temperature. What's your feeling temperature about this? And that'll give you a gauge for how much they're worrying. And then, open-ended questions. What do you know about it? What are you thinking? And then answer those questions as factually and calmly and matter-of-factly as possible. And then finally, caring. This is the time we all have actually some extra time on our hands from not commuting anywhere. But what's important to you in your life? What are your values? What is most meaningful for you? This might be the time to shift your focus to those things. And, crisis can bring the best out in us. So focus on cultivating those relationships and bonds with your family members, on healthy activity, on spiritual time or religion or prayer, connecting with your faith groups if that's important to you, compassion for others. We can help online, remotely, and then practicing gratitude. Because yes, we're in tough times, but I'm sure each of us can find enough things to be grateful for in our lives. And that, I think, shifts our focus from the worry and what we can't do to taking charge of what we can do.
Thank you so much, Aureen. That's all really great advice. I'm echoing in someone's speakers, so it's okay. So we have a bunch. Let's get to them. Real quick, there's a lot of great specific OCD questions in relation to COVID-19 that I want to answer. But Thomas asks a really great question. It's a little long, but it's okay. The gist of it is, a lot of people are using OCD and what's going on intertwined, and it's touching a lot on stigma. So the question, sorry, Jess, is at 2:03 p.m. He says, as an advocacy and OCD social question, these past couple weeks I've heard celebs, talk radio, TV, even friends, that this is really giving them anxiety, or we need to start being OCD about this situation regarding cleanliness and such. I don't believe this is a peek into our world. We'll take this in a minute because we just lost 2 of our guests. This is a peek into our world because health anxiety is a normal human experience. Dysfunctionality anxiety is not. So while this is certainly a legitimate reason to feel anxious, how do you think we can address statements like that? So let's go ahead and take that question down just so we can see Reid. And I'm going to throw this out to Shala, who is in charge of our OCD task force at dealing with how to address OCD in the public for the IOCDF. Shala.
Sure, that's a great question. And in fact, the task force, the Real OCD task force for the ICF has been addressing this all week. We've seen a number of posts online where people are misusing OCD. And what I would say is how we've been responding is something like this. We know you don't mean any harm with what you're presenting online or in social media, but OCD is the 10th most disabling condition in the world. That by misusing OCD, you can actually keep people from seeking treatment. And so please help us to not use OCD as a punchline by taking this down. And so we're trying to put compassionate responses up where we're acknowledging that they're not trying to be mean, they just don't understand. But trying to help people understand that the biggest issue with this is that it can discourage people with OCD from seeking treatment. Because if everybody's a little OCD, we should all just get over it, right? It's not anything that deserves treatment, and that nothing is farther from the truth. So I would say, if you're comfortable doing this, post some responses like that. And I think we could actually add some of the responses that we have done onto this thread so people can see the things that we have been posting. Copy and paste some of what we've been doing and post it yourself, because what we've noticed is the more that people will respond, people will take things down or change them once they realize the consequences for having the misuse of OCD up like that.
Thank you, Shala. So let's go, and thank you, Thomas, for that's a really good question. So let's go to Peter's question at 2:04 p.m., Jess. How to handle the anxiety around grocery store trips and paranoia about sanitizing packages and food would be really helpful. So, Reid, you go to the grocery store, you're seeing people sanitize, but then you get home and there's cross-contamination, and I want to touch this food, and I just wash my hands. How do we deal with this new normal?
Well, I think there's not. So here we are with the uncertainty again. There is not a clear set of rules yet. One thing that we seem to know now is that the virus doesn't seem to be transferred through food itself, but when people have been handling the food, and we don't know whether they have clean hands or not, now we're bringing these packages through. It really reminds me of clients I worked with a couple decades ago around having to wash everything from the grocery store before they bring it into the house. My opinion is, one, create rules about what you think you need to do from groceries that are coming in the grocery store. And I don't have a problem if you want to wash everything before they come in. If you want to wipe down everything before it gets carried into your kitchen, I think that's fine right now. We're in this crazy time, and it's not necessary that we go hard and fast around some intensive anti-compulsion rules while we're in this degree of uncertainty around what's safe and what isn't. Now, I'm sure other people will have a different opinion than me. I'm more lenient right now.
Well, I would like to harken back to both you and Shala and Kim Quinlan wrote a blog article that sort of touched on these. So in that blog article, Shala, some great advice that you gave was also, use the CDC and WHO as a barometer of things that you should do and shouldn't do. Can you speak to that just for a minute?
Sure. And that can become the exposure. So, right now what I'm trying to do is follow those guidelines, but I'm trying not to go overboard and do more than those guidelines. And that becomes my exposure. And I think if you use the guidelines, as Reid mentioned, having rules, if you want to use those as your rules, great. That gives you a way to be able to go through the world day by day and decide, what am I doing? What am I not doing right now?
That's great. Thank you so much. Yes, please, Aureen.
Quickly add just a quick comment. I think there's no hard and fast rule about this, obviously, but each family has to size up their risk issues. So, there may be families with elderly relatives living in the house. They would need to be much more careful about bringing groceries into the house. There may be families with, young children. And although we know that generally children aren't affected that much, they're still young and their immune systems are developing. So I think that can affect also how families look at that.
Thank you, Aureen. And thank you, Peter. Great question. Let's go to Alyssa Alexander at 2:04 p.m. This is a really interesting question. So actually, I'm going to toss it out to the entire group. So Alyssa asks how to deal with all the conspiracy theories surrounding coronavirus. I have existential OCD and have seen many theories that the world is ending the way the Bible has prophesized. Who would like to take a crack at this question?
Well, I'll go back to what I was saying before. Here is an excellent example of what I was speaking to. If Alyssa's getting all caught up in this existential anxiety related to her OCD, she's not going to come to a conclusion. The OCD is not going to allow her to do that. And what I would suggest, if she were sitting with me and asking my advice, I guess maybe she is, I would say, make that none of your business. It is, you're not going to win this topic. Let other people try to figure this thing out and focus on the here and now, taking care of my family, myself, my loved ones.
That's great. Aureen or Shala, do you have additional? Okay, perfect. Thank you so much. Great question. Shira Folberg at 2:05 p.m. Jess, this is actually a really great question. What are some ways we can come together virtually as an OCD community to connect and support each other in a time of social isolation? I'm actually going to take this question real quick because it speaks very much to advocacy. And, you know, this right here is a perfect example of ways we can come together and support one another. But what's cool about advocacy is this is a really neat opportunity. I'm not saying COVID-19 is neat, but I am saying there are silver linings to everything. And there are a bunch of silver linings to this. I've probably talked to more friends this week on the phone than I have in the last 10 years because we all want to be there and support each other. So that's something I can be grateful for right now. But I think there's an opportunity for all of us to be able to advocate in our own lives. However, that Shira, if you have a couple friends with OCD that maybe you're all struggling right now, maybe you all jump on a FaceTime call. I have friends on Facebook that are creating Zoom support groups. They have Zoom, they have access to Zoom or other virtual meeting software. And they're creating their own support groups around the country and around the world where they decide on a time and a place to meet up and just be able to support each other and be there forever, be there for each other. So I think now is a really great opportunity to take a grassroots approach to advocacy and a grassroots approach just to supporting one another, whatever that looks like for you, in a way that makes you feel comfortable. You don't have to do it on a national stage like this. You can just do it with one FaceTime call. I do want to give a shout out to two really awesome platforms as well. One is the app NoCD. If you have access to the App Store or Google Play, you can download NoCD. NoCD has a very, very vibrant OCD community with hundreds of thousands of users trading comments and information. They also have virtual support accessible in specific states. You can get more information from downloading their app or going to their Facebook or social media pages. The other place I want to tell you about is Health Unlocked. Jess can put a Health Unlocked link on this thread, but Health Unlocked is the IOCDF's chat community, where it's also a very vibrant community of individuals that are supporting each other during this time. Anybody else want to throw anything out on that? Yes, Reid.
I have a question to Aureen, if that would be okay with you.
Yeah, of course.
If she's
but you're not getting my paycheck. No. Just
so I have a client, a young girl I'm working with her father. Her mother's kind of not connected with the therapy, but the mother's very careless about this child and her contact out in the world. So, you know, the father's trying to explain the reason I'm not taking you to Walmart is I don't, you know, if you touch this, we don't know who has touched it, blah, 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 trying to educate her about all of this. The mother today is taking her to Walmart. Mm-hmm. And so the issue I have around kids is that kind of confusion that gets caused and her coming back and having to tell dad, yes, I went, but I've made a mistake and so forth. And I wonder if you have any thoughts around how do you manage kids where we're trying to age appropriately educate them, but not freak them out. And of course, this particular case is a little more extreme.
Yeah, those are challenging situations. And I'd say to parents, to the extent possible, perhaps they need to sit down together and have a face-to-face, one-on-one and say, can we agree to some common, consistent, common ground? It's not unlike any other parenting issue, right? That when there's consistency between parents, the kids do better. So obviously this child is going to be confused, and I don't know what their situation is, but if they can agree to certain terms, or if the child has to go to Walmart, then what are some cleaning behaviors after that? So if the parents can talk and come to agreement, that is the best. But Ethan, I wanted to add something to what you said earlier, that I would also recommend for the OCD community to reach out to their non-OCD friends and relatives and people we may have lost in touch with. I think it gives a nice balance. And, I'm thinking for myself, now I'm home, I'm not driving to work, I don't have as many appointments. I should, contact all these friends that I've been feeling guilty about not being in touch with. So this is where, even though we are socially distant, it gives us a wonderful opportunity to be socially more connected. Okay. And if you took that a step further and you wanted to be caring and compassionate, I think there are websites where you can reach out to seniors who are alone or lonely in their nursing homes to talk to, or people that need someone to talk to. And that's a way of giving, again, of turning around something that's not good and making it good.
That's a great point. Dr. Michael Janicki has always said for years and years and years, the best thing you can do for your OCD is help other people. And I found that to be one of the most truest statements in my own life. And one of the interesting things during these times in this situation is, for those of us that have OCD, that have had some sort of exposure response prevention treatment, we have insight into dealing with uncertainty that the general public may not. So we actually have a lot of value to offer right now. So, even though we are struggling and maybe more triggered than usual, we also can reach out to people, like you said, without OCD and probably provide a lot of insight into dealing with uncertainty that they might not know. So it's a really opportune time to take a moment and reach out and kind of look to our neighbor and go, hey, are you doing okay? So that's a great point. Shala, a couple people love your book. Just wanted to shout that out. So Joanne Winston at 2:10 p.m. Hi, Joanne. It's good to see you. I'm glad you're here. So Joanne writes, I'm trying to be compassionate to my daughter because this is a stressful time. However, I find myself reassuring her too much. How can I help her without getting frustrated and stop reassuring her? Aureen.
Joanne, I would recommend you set up prescribed, structured discussion times. I don't know how old your daughter is, if she's a child or a young adult, but I would recommend 1 or 2 times a day when you say this is our check-in time to discuss the worries. And outside of that, we have to defer them. There's no discussion. But if you feel like you can't wait, then you can write them in a journal and bring the journal to the worry time. So you really do have to contain the worry. Otherwise, like you said, it is going to get frustrating, and it's actually going to make the OCD worse because it's that cycle of escape from distress.
Thank you, Aureen. Desiree at 2:10 p.m. This is actually a therapist asking a question to other therapists, which I love. So for you clinicians out there that are here to also seek support during this, thank you so much for tuning in. It really means a lot. So Desiree Howard at 2:10 p.m. I'm a therapist in the very early stages of ERP with a client who has contamination obsessions, just made the hierarchy. Guidance from the facility I work at wants everyone to only do telehealth appointments for therapy unless clinically indicated for face-to-face appointments instead. I'm not sure what to do now because it seems that messaging from everywhere right now only confirms contamination-related obsessions. How am I supposed to help my client? And unfortunately, it doesn't go on, but can I even do exposures, et cetera, et cetera? Reid, do you want to take this?
Sure. I'm not, to me, it seems like you can do fine doing that. It is, especially if you can do face-to-face like we are doing here and talking to them. I do that. I've done tons of that, and we just discuss together. We know what their hierarchy is. We talk about what we think they need to do next. I absolutely don't have to be present with them while they're doing an exposure. We just need to get clear around what's my intention for the exposure, what's the strategy I'm going to use, how long am I going to do it, what do I expect I'm going to feel before, during, and after. That I can get from my therapist. And I've done both setting these up with them and then allowed an email exchange after the practice to find out how it went. An email exchange for us therapists, it takes 6 minutes or so, even with some thoughtful response, but it can be very useful to help somebody continue to do the next level of their practice.
I'm going to dig into, so just like, we can't do this stream perfect. So we are now discovering with 4 people and really long questions that when it comes up, Dr. Wilson and Dr. Wagner completely disappear. So we're in the middle of trying to figure that out right now so they can still see the questions. And at the same time, we can see their faces.
I'm happy with that, actually.
Yeah, that's fine.
You've never looked better with big questions, Dr. Wilson.
Can I add something, Ethan? I would agree with Dr. Wilson. I've been doing telehealth for a while, and now I'm pretty much all telehealth because we're not going into the office. And actually, a lot of types of OCD lends itself better to telehealth because the person is in their own home environment where most of their triggers are. So in fact, just yesterday, I did a session with a young girl in Wilmington, 2 hours away, and she has contamination OCD. It's not about the corona, but everything else. But I was able to have her walk around her house and touch the things and hug her father. And, she wouldn't have any contact with her father because she thought he was contaminated. So really, we did a lot more that way than when she would drive up to see me in my office. So there's aspects of just right OCD. You can have people mess up their routines and disorder things and, do the wrong order. So it actually can work quite well with telehealth.
I'm actually going to dive into this question just a tiny bit more because don't put it up, Jess. It's okay. So I'm going to throw this out to Dr. Wilson. I know you couldn't read it, Reid. In this question, she says, because it seems that messaging from everywhere right now only confirms contamination-related obsessions. In other words, wash your hands a bunch, make sure you're overly cautious. How am I supposed to help my client now? Which goes back to what you were saying before, but she's asking, hey, look, if the government is saying do the things that I've been telling you not to do, how can I help?
Yeah, and you're asking me.
Yes.
Yeah. My hard and fast first approach is to create rules. Let's decide. And that I'm going to leave that up to the client around what the rule specifically is. But you got to create a rule and lock it down and follow it. Because if you don't do it that way around these kinds of questions, we know what happens with obsessions, which is, I don't know what to do right now. Should I do this or should I do that? So we really want them during a no problem time when I'm not in the middle of an obsession and I can think logically about the strategy, figure out this is how long I'm going to wash my hands with what detergent after what events and stick to that. And that's where I would go.
Go ahead, Shala. Sorry, Aureen.
Oh, sorry. I would add too, that anxiety is always contextual. So it all depends on the context. Right now, the context is calling for us to wash our hands more and cleanse more. But even so, there's what's reasonable and that's what's excessive. So that's the distinction. What is reasonable? What is excessive? How should people with OCD know what's reasonable? Follow the guidelines, the health guidelines from this, take a reputable source and follow them. Look at family members who don't have OCD. What are they doing? And stick with that. So yes, we all should wash our hands when we come in the house now, but should we wash them 16 times? That's the difference.
Yeah.
And I think that's what Shala would add is for therapists and clinicians, even though I'm not one, using the CDC and WHO guidelines as your benchmark for where you should start. And then anything above that, we need to look at as OCD and treat it as such. I'm going to try to read this question just to you guys because it's going to block Reid and Aureen. So I'll read it slowly, but I get the gist of it. So this is from Sita Nataraj Slavov. Sita, if I got that right, comment later and say yes, because I want to feel cool. And if I didn't, I sincerely apologize. It's a beautiful name, though. So I have a question about perfectionism and social distancing. Many public health experts are recommending some pretty extreme social distancing measures. Some people are following them very carefully, but many others are being inconsistent about it. How can someone with OCD decide what is reasonable versus perfectionistic, not just in terms of our own behavior, but also in terms of what we can impose on others in our household when it comes to things like limiting visits? Shala, you want to take that?
Sure. I think here, again, if we go back to what Reid, you were saying earlier about rules. So decide what rule you want to follow, and then do your best to follow it, but not perfectly. We don't want to be walking around with a yardstick or whatever, keeping that mountain distance between us and other people. We sort of ballpark what 6 feet is or whatever. And just, I would say, do your best to stay with whatever your rule is, but recognize your rule is your rule. It's not other people's rule. And those of us with OCD, we're going to notice people who aren't practicing social distancing.
Mhm.
I know this because my head has been like, oh, those people are way too close together. And just recognize that's what we're going to do. We're noticers. We're going to notice these things. We don't have control over other people, and just try to do the best we can to stay within our guidelines, but again, not perfectly.
That's great. I think everybody's like that. I'm in the store and I hear a cough and I'm in, where'd it come from? Okay. You know, where's this cough? I think this is
What
a
are you
really
doing
meaningful.
in a store?
I'm sorry.
You
Yeah,
are one of the young people.
I know. I just got back from the beach at spring break. Kidding. That's a joke. I was not at the beach. People who know me. I don't even go to the beach. Okay. So I think this is a really important observation to make for everyone watching right now, which is, and this is different than what we had before, but it speaks to the common humanity of this situation, which is we're getting a lot of questions from clinicians. There are a lot of clinicians watching right now. And so it's very important, if we're answering a clinical question, for a clinician to better support an OCD sufferer. For the OCD sufferers that is on this, it's important to recognize that at the end of the day, we're all humans dealing with a crisis right now and determining how to best ways to deal with it. So in this room right now, there's a lot of common humanity, which just means we have to recognize that we're all struggling in our own way. And so take a moment and realize that nobody here knows the answers perfectly. Nobody here knows the right answers. There's no hard and fast rules, as Reid said. We're all here knowing what we know and trying to work through this together the best we can. So so thank you for the clinicians for coming out and being willing to speak your own truths and advocate for yourself in an effort to help the community that needs you right now. So with that, I want to bring up Kathy Rothfielder's question from 2:11 p.m. I wonder if Shala could talk a little about imposter syndrome for those of us who are therapists and also have OCD, who are seeing spikes in our own severity and having trouble staying grounded in these times.
Sure, that's a great question. It's one of the reasons I've been wanting to do the writing, like the open letter to my OCD and other things I've been doing, because I want to normalize, as a therapist who has OCD, that my OCD is pretty riled up right now. And I think that's to be expected for all of us who have OCD, because the message now sounds like what our OCD has been telling us our whole lives. And so it's getting that reinforcement that the world's dangerous, it's chaotic, it's contaminated and bad, and we need to beware. And so I think that you are not an imposter if you're treating OCD and your OCD is all riled up right now. You're just a normal OCD therapist who has OCD. I think being really super compassionate with yourself, that it's okay to feel like that. And it's okay to have to do some more work than you normally would have to do to keep your own disorder in check. So just be super, super compassionate. Don't even use the word imposter. I would not use that word, just because you're not. You're just like Ethan was talking about earlier. This is a situation of common humanity. Everybody on this planet is struggling right now. Those of us with OCD are going to be struggling perhaps a little bit differently than other people, and maybe sometimes a little bit more. So that means we just need that much more self-compassion, which is why, I mean, I have my self-compassion bracelet on. I'm wearing it every single day now to remind myself I have got to be nice to myself. That is like thing number one, because this is hard.
Let me throw in one thing that I was kind of looking for a place to say this. And what I want to say is welcome to the club, because everyone who has a brain in their head and is paying attention to what's going on is going to be psychophysiologically aroused 24 hours a day. Even if you're not having a worry or an obsession, if you tune into yourself any particular time during the day, you're going to notice this. And worries are just going to kind of float up and out again without you necessarily digging into it. But we are all in this kind of aroused state. Great, as Aureen was talking about, learning to do some meditations and relaxations and so forth. But when that's not happening, we got to own up to the fact that we are disturbed by this, and we should be until we figure this thing out.
That's great, Dr. Wilson. Thank you. just so everyone knows, I'm seeing your questions. I'm trying to get to a diverse question, so we're not answering. If hopefully we'll answer your specific question in another question. If we don't, we'll provide resources at the end where you can email and ask your question, and we'll definitely get back to you. This is an interesting question, and I think I'll preempt it by saying, you know, it comes down to uncertainty, but I'm going to ask it anyway because it's framed in a really interesting way. Doctor, you can be a doctor. I don't know. Maybe you are. Stephen Henry at 2:14 p.m. Stephen's question is actually specifically for Dr. Wilson. He's bypassing me. Thanks, Stephen. Appreciate it. What do we do if we don't trust that the world leaders and scientists have this and are the prospect that this is truly unprecedented?
Well, I think it's fine to do anything you think you could do to influence decision making and so forth. The only thing I was trying to clarify is that if you are being incapacitated by your worry and distress about there's not an answer yet to this global problem, that you should suspend your responsibilities around figuring that out. Otherwise, be an educated consumer, do what you can. I mean, what some leaders are doing right now is just sinful to me. And so be an activist if you can, and let's change a system. And I think, but you know, if anyone was following last night, we've got hospitals and towns asking for volunteers with sewing machines to make masks so they can go to work. And whatever we have to do as a community to contribute to solving this problem, we can't be waiting for somebody else.
Anybody else like to weigh in on that?
Do I sound passionate?
No, not at all. It's quite boring. Yeah. No, I agree. So I'm just scanning these questions. There's a lot of good clinical questions, and this just gives me an idea that we should probably do a clinical town hall as well, if we haven't. And anyway, just throwing that out to the clinicians in the room. I only played a doctor on TV, so it's not as impressive. So, okay. So Samantha Jean at 2:19 p.m. Aureen, I'm going to throw this your direction. Any advice for pregnant women suffering with OCD at this time? I am 6 months pregnant and trying to remain calm, but I'm finding it increasingly difficult. I'm able to stay inside and work from home, but my husband still has to work. So every time he comes home from work, my fear is heightened. And I would imagine, Aureen, that, you know, when the baby is born, it will become something even more. So go ahead. Yeah.
Samantha, I'm a mother, and I remember what it was like to be pregnant. There's always that additional share of worries about your baby and your health and your baby's health. So I certainly have a lot of empathy for that. I would recommend you talk to your OBGYN and ask them for, again, that set of matter of fact, you know, health-based scientific guidelines for how you maintain your health and your baby's health, and you follow them. I'm not a physician or an OBGYN, so I can't say exactly what those are. And then when your husband comes home, he should also follow the guidelines provided by your OBGYN and general CDC guidelines. And then other than that, again, I think you focus on the things you can do and take charge of.
That's great. Great. William Jensen, 20 p.m. is asking, I keep swallowing to see if my throat hurts from COVID. And of course, then it hurts and it's hard to stop. Any advice? Shala.
Now you can hear me. Okay. We got a similar question to this one last week, and I'm going to steal Kimberly Quinlan's answer to this, which was, you know, if you're feeling like you have a sore throat, you know, the more you focus on that, the more you're probably going to feel like you have a sore throat. So you can turn that feeling into an exposure exercise and say, okay, well, I feel like I have a sore throat. Great. There's a sore throat here. And I'm just going to be with this feeling of having a sore throat, because if you're continuously monitoring it, you're just going to feel it more. So really what we're doing is accepting that it's there and sort of embracing that it's there and saying, okay, well, it's here. Great. This is a good opportunity for me to practice being with a sore throat right now.
Mm-hmm. That's called selective attention and confirmation bias. So when something makes us anxious, we pay more attention to it. We selectively notice those things more. And then when we look for those things, we confirm that they are present. So that's how our minds work. So again, just being aware and even saying to yourself, oh, there I go again. I'm paying too much attention to it. Oh, this is confirmation bias. Sometimes even labeling the cognitive errors can be helpful to step out of it and have that perspective. Oh, there's my OCD again. Oh, that's my anxiety acting up. So that's what I'd recommend.
Great.
I think it's hard. It's a hard time right now because as someone recovering from health anxiety, I think that in general, you scan your body daily, look for things that may catch your alarm, and then focus on them. And when you reach a stage of maintenance, you sort of put those things in the background, and you've learned to, oh, I may feel this or notice this, but I'm just gonna accept what that is. I don't know. I'm not sure, but I'm going to go on with my day. What's making this really difficult is now all of this COVID is in our faces. This virus is in our faces. It's constantly being pummeled at us on social media, news, conversation. It's everywhere. And so now we're in a situation where we scan ourselves. Yesterday, my cheeks were flush. My cheeks were so hot. They felt like they were on fire. And I got panicky. I get anxiety.
That way right now, too.
I know. I know. God.
Okay.
Anyway, you know what? And it just is. You know, in this moment, maybe I have the virus, maybe I don't. But at least right now, I'm going to finish this because this is what's important to me, and then I'll figure it out from there. No, I'm just kidding. Anyway, so
hey, Ethan, could I jump in with one quick additional thing on this?
Yeah, I was just going to finish my point. It's fine. No, go ahead, Shala.
Now my cheeks are going to turn red because I'm going to get embarrassed. I think this is a great time to learn meditation. We all have extra time right now. Like Aureen was saying, we're not commuting and spending time doing other things. Meditation is so helpful in situations like this because it allows us to be with what we're experiencing without judging it. I've noticed just during the time we've been talking so far, I've put my hand on my face twice and I just stuck the end of my glasses in my mouth 5 minutes ago. These to me are examples of I could be more mindful, right? I still don't, my hands don't know what they're doing. I think if we can use this as an opportunity to learn how to be mindfully aware of how we're feeling, what we're thinking, how we're acting, this is a great way to increase mindfulness skills that will help not only in this current situation, but just in life in general. There is a great podcast. Sam Harris has a podcast that I think it's called Making Sense. And his most recent episode, which I just listened to this morning, it's all about mindfulness and meditation, was exactly about this topic. It's a quick 17-minute listen. So if you have time, listen to that. And he explains more about why this is so important.
And Ethan, you want to finish your thought?
No, it's fine.
I'm
going to live with non-completion. Yeah, go ahead, Reid.
I want to throw in one more thing. So the other thing that OCD loves to take advantage of is novel experiences. And so our last guest who was asking this question around swallowing. So the issue around swallowing is brand new for him. And OCD loves to dig into those yet because I don't know yet whether it's a signal or noise. And so as soon as I can start looking at the pattern, step away from the content of it, swallowing, to the pattern, I'm focused in on a behavior, feeling apprehensive that I may have something wrong with me, and then continue to check, then I can label it in a little what Aureen was saying about stepping back and going, okay, oh, here's a new one. Again, OCD loves them. So let's catch them as quickly as we can and establish how we're going to respond to them.
It's a novel coronavirus in more than one way.
You got it.
That's true. That's true. Jen Hughes at 2:22 p.m. Any advice on how to cope mentally if we do contract the virus? As I can't really comprehend how I will be able to cope without a complete breakdown occurring. Who wants to answer that?
I'll go for it.
Go for it, Aureen.
I'm not a medical professional, but I think contact your physician right away. Follow the steps. Again, the CDC, I think, offers guidelines, or talk to your physician in advance if you want to know how is your doctor's office going to handle it if you have symptoms. And I think generally they want you to call in first. They'll go through a checklist of symptoms with you, and then they'll give you the advice on what to do next. So listen to them, follow them. They might say, stay home, rest, isolate yourself. They might say, If this happens, then call again, right? So take it one step at a time, one day at a time. Now, again, our minds, again, if you have anxiety or OCD, can go from 0 to 100, from nothing to catastrophe. Don't forget, there's lots of stages in between. And we also know about the coronavirus that most people have a mild illness that remits on its own and they don't get more sick. So there's a good chance you could be in that percentage of people that gets well spontaneously. I don't know much about anything about your history, obviously, but focus on that rather than the one catastrophe that could happen.
Let me throw one other thing in. I think that's relevant here too is OCD loves when you look into the future.
Mm-hmm.
And so one of the issues that Jen may be having is about lifting her eyes up into the future that is unknown. And that makes it difficult for her to imagine herself solving this problem. And if we can, again, recognize the future is OCD's territory. I need to come back to the present moment. I need to be mindful about right now. I will cross that bridge when I get to it. But it's just a pattern we need to make sure we understand around the unknown future. Uh-oh, I can't figure it out. I need to be obsessed about that.
Actually, let me add one more point to my earlier thing. So when you talk about, having a complete breakdown, that's sort of like that panic state. And so I would go back to the feeling thermometer that I talked about earlier and ask yourself, what's my feeling temperature about this? And I would say if you're a 6 or 7 or higher, I think you need to set aside all the, information you're reading because your brain is not going to process it properly. Our, rational brain does not think well, does not problem solve when we're very upset, when our feeling brain is activated. So set it all aside, work on calming down, use some of those meditation techniques that Shala was talking about, and then only when you're a 5 or below, that's a rule you can make. Only if I'm a 5 or below will I call the doctor, look at the news, talk to X, Y, and Z. That if I'm a 6 or above, I need to kind of focus first on calming down. Otherwise, in the midst of a panic, you're not going to hear the information correctly, and you're going to escalate the situation.
Okay, now I'm going to add one more thing to that because that's great. So
this is like a presidential debate. I can't even get a question in.
No, I'm agreeing with everything Aureen's saying. I'm just embellishing and having ideas from each other, which is, wait a minute, I don't know how I'm going to cope if that happens. Well, when your temperature is 5 or below, then sit down and brainstorm and problem solve how I'm going to handle it. What we do, again, here's this worry making machine. And when we worry about it, we think we're problem solving. We are not. So answer the question, here's how I will cope, as opposed to throwing up your hands and going, I don't know how I'm going to do it. This is common for everyone, not personal to Jen.
So I'm going to add one more. So make a proactive plan when your feeling temperature is down. So I'm just reinforcing what Reid is saying. Now's the time when you're calm to make the proactive plan for all these possibilities that you're seeing. What if this happens? What if that happens? What if X happens? Make the plans when you're calm, type them up, laminate them, put them on your fridge if you have to. There you go.
Yep, there it is.
Sorry. No, I'm just kidding. I just want to, here's what I want to say, and we're actually running out of time, so we may do a next town hall and increase the amount of time. And I'm going to give everyone final thoughts. But here's what I want to say from a non-clinical perspective, which is that this is uncertainty. This is what we're dealing with. We're dealing with uncertainty, and it's we were dealing with it before this, whether you have OCD or you don't, and we're dealing with it now. I think the big difference is if I use the exercise analogy with ERP, before we go to the gym, we start to do exposure response prevention, and we add weight incrementally. As in each time we get the weight gets comfortable, our therapist adds a little bit more weight to it, and we go from there. In this situation, the situation itself is creating the weight. We don't have control over the amount of weight that we're having to deal with right now. And I think because of that, it's creating this feeling of this inability to cope with and manage uncertainty. and also this feeling of inability to manage and tolerate discomfort. Because right now, all of our baseline discomfort has now changed for everybody on this planet, from wherever it was to this new baseline discomfort. So we're all having to readjust and reevaluate. And there's all these anticipatory anxieties about what if, and if I do get, and all this other stuff. So I think it's worth going back to the basics of ERP training and looking at, am I okay not being okay? Am I okay being uncomfortable? Can I tolerate the discomfort? What does uncertainty look like? What are my values? And really going back to those core precepts of ERP and the training that we've gotten to really sit with what's going on and make value-driven, informed decisions. And I think really that's what any of the questions that everybody's asking, no matter what the minutia, because Reid will tell you the minutia, the OCD, the content, same with Aureen and Shala, the content doesn't matter, right? OCD is OCD and OCD. And regardless of the symptom, whether it's a sore throat or an uncomfortable feeling or the news or the person saying it, at the end of the day, we're dealing with the unknown. And how do you deal with that? And I think maybe going back to some of the original precepts and looking at the basics of dealing with anxiety and OCD could be really helpful in this. And if you haven't had OCD treatment, definitely check out a variety of websites. We'll put a list of resources where you can start getting that information that can help you. With that, sorry to go on a rant. See, Reid, I'm trying to match your passion. So almost there, close enough. So with that, I want to give our guests a moment to have a final wrap up. Shala, when you're ready.
Now I'm going to have to try to match both of your passion levels. You can do this. If you've done exposure, if you give exposure to people for a living, you have the skills to be able to do this. You're going to be anxious. You're not going to do it perfectly, but tell yourself over and over again, you can do this. Tell your OCD, write it a letter that you are going to do this, even though it's going to win sometimes. This confidence, this putting your shoulders back and having belief in yourself, it matters. And it matters a lot right now.
Dr. Wilson.
I'll rest with what we've said.
Okay. Dr.
Okay.
Wagner.
Okay, so we will get through this. We will get through this together. Remember, ironically, social distancing might bring us closer together. Social distancing is only physical distancing. And thanks to technology, for which we can be very grateful, look how much connection we can have that's beyond what we would do physically. So let's look at the bright side of things. Let's look at what we can do. Crisis can bring out the best in us. Let's think about what's important to us now. What are our values? What are those priorities in our lives? You know, a lot of times when people go through tragedies and crises, that makes them stop and take stock of, you know, oh, my house got burned in a fire, but you know what? It doesn't matter. My family members are safe, and that's what's most important. So this is a good time to take stock of that and refocus. And like I said, social distancing right now might actually bring us closer together. Look at all of us here. Hundreds, I don't know how many of us are here or how many will view this. We're all supporting each other through this. We will get through this.
So true. It's such a great point. Just like, you know, when I was forced to be away from my parents with my OCD, we had this terrible enmeshed relationship. And then I lived across the country from them, and we became closer than we ever had before in the healthiest way possible. Real quick, as a thank you to the guests also, we were talking about resources, and it just so happens that we have some very, very well-established and prolific authors in the house. So for people that are looking for resources, if you don't have treatment or access to therapy right now, Dr. Wilson, where's a place that we can find your books?
There's a lot of free short video clips on my website, which is anxieties.com, ANXIETIS.com. And I just go there, and because all that stuff's free.
Okay, so Jess, we'll put a link to that in the comment thread, and then Dr. Wagner, we actually have Dr. Wagner's website, which I will quickly say it's anxietywellness.com. You have all your book information on that. So for moms, kids, go ahead. Yeah. And
I also have free videos on there. So there's a bunch of free videos you can look at on there. And so also, as of now, you can download a free copy of the feeling thermometer.
Amazing. So definitely access. And then Shala, Obviously, you can visit shalanicely.com. She has an incredible blog. She's constantly posting about her thoughts. She's not private about them at all. We know everything about her, along with her book. So we really appreciate your candidness. Just a final shout out to all of you that's watching. I want you to know that for those of you, families, friends, kids, teenagers, Chris Bear, who is the producer and a wonderful OCD advocate that produced the amazing documentary Unstuck, an OCD kids movie. They're hosting a free screening tomorrow at 12 p.m. Eastern via Zoom. If you go to their Facebook page, the Unstuck Facebook page, we'll also be putting a link in the comment thread. If you haven't seen the documentary, it's all about kids and their OCD journey. It's really beautifully done. I would definitely take this opportunity to see it for free. I want to thank our guests, Shala Nicely, Dr. Reid Wilson, Dr. Aureen Wagner. Thank you for taking time out of your Saturday to give us your expertise and support to not only the community, but the clinicians and everyone that's dealing with this during this trying time. I, of course, want to also say that throughout the thread, there'll be all of the resources. Feel free to go back in the thread. They'll be up on Facebook and YouTube if you want to look for resources, links to different websites, and so forth. Of course, I want to thank the International OCD Foundation for giving us a platform to be able to support the community in this way. Also, I always give out my email, so you can always reach out to the IOCDF. They have a person on staff there ready and willing to answer any questions that you may have, whether it's specific questions or questions about resources. So don't hesitate to go to their website, iocdf.org, and reach out to them. And also always email me. My email is justethan@iocdf.org. I will always get back to your email, even though I have some emails from 2 weeks ago that I haven't gotten back to yet. It's been crazy. I'm not perfect, but I will get back to your email. I promise. And the last announcement is that people have been asking if I'm going to do just a regular Just Ethan like I was doing every Tuesday. And the answer is yes, I will be. So this coming Tuesday at 7 p.m. Eastern, it will just be me. This week's topic is I want to just talk about thoughts and feelings on everything. There isn't really specific other than how I'm feeling. And I want to share it with you guys personally and let you guys share how you're feeling with me and just have a one-on-one conversation. So Tuesday, 7 p.m. Eastern on Facebook. Join us then. Again, I want to thank all of our guests. Please don't hesitate to reach out, contact the resources. We are here for you. And hopefully we will see you. Lastly, we will be back here on next Saturday at 2 p.m. We'll have another group of guests joining you with Dr. John Hirschfield, and Kimberly Quinlan again will be joining us. So for today, thank you so much. Take care of yourself. Stay safe, stay vigilant, live your values, and we'll see you next time.